Merci beaucoup, Monsieur le Président. Ça me fait un grand plaisir de me relever pour appuyer le budget de notre gouvernement. Reinventing New Brunswick together. Mr. Speaker, the Finance Minister spoke of many challenges that our local government system faces. Understanding these challenges and the impact they are having and finding solutions means working together. Our common goal is a continued quality of life for all New Brunswickers. Over the next year, a lot of focus will be on understanding issues and planning a path forward. Quand on parle à propos du gouvernement local, puis pour créer les municipalités plus grandes, pour donner les gens à la campagne une voix réelle gouvernementale, c'est quelque chose de vraiment important. This will require broad discussions and a lot of cooperation on the part of New Brunswickers. We need to discuss our differences, and, Madam Speaker, we need to discuss what brings us together, what binds us together as citizens of this province. We all come from communities. We all move, some of us move to new communities. I grew up in Chatham. Now they call it Miramichi. I moved to Woodstock. That's my home. As I said yesterday, I raised my family there. Je suis tellement fier d'être un citoyen de Woodstock. I'm as proud to be a citizen there as anyone else is of their community. And I think when we get into the discussions around local government, local governance, then it will be vital that our citizens understand that this is not about taxes. This is about having a real voice to make a change in the community in which you live, in your rural community. Hopefully, before the end of our mandate and through the work of this budget, we will have rural municipalities that will have elected councils and mayors, where the citizens, as we do in all the other municipalities, can have a say in where their tax dollars are spent, and can talk about what kind of services they'd like to have. When I was campaigning, une chose que j'avais entendu beaucoup, c'était à propos du niveau de le service de la police. Chez nous, en particulier à la campagne, au Nouveau-Brunswick rural, il y a tant de crimes. And citizens are frustrated through no fault of their own. Farmers can't leave their tractors in fields overnight for fear that someone might steal the wires so they can sell the copper. They want this addressed. The best fashion that they can have to address that is through the creation of a municipal community, a regional municipality. Have a say in their own future. And I know a lot of people that will be happy when they can decide the level of service that they'd like to have. when they can negotiate the level of service that they'd like to have. Because that is what the people of the province want. Ce n'est pas tout le monde qui habite dans les cités ou dans les autres villes. We have people in our province, you know, they're all over the place. And in order to get the services that they desire, in order to repair the roads, they need to be able to say, this is a priority for us. We elected you to make sure these things happen in our community. It's extremely important. Madam Speaker, locally elected officials will be key players as we work our way forward. On May the 10th, elections will be held for local council, regional health authority, and district education council representatives. Elections NB website has the most necessary information for anyone interested in offering to fill one of these important roles. And thank you again to all the councillors and mayors who had their terms extended and continued to sit and govern their municipalities or stay on their district education council or serve on the regional health authority for an extra year. For some people, they planned on running again. For others, they were at the end of their term. They were ready to go on and do something else. But without volunteerism, without people stepping up in our province to make it a better place, we would be in big trouble. These terms were extended, of course, as we all know, because of COVID. And without their goodwill, we'd have a lot more work to do. Madam Speaker, it was just a couple of weeks ago, March 8, when our province returned to the yellow phase of COVID precautions. And hopefully, God willing, we'll be in green sometime in the fall. Car la majorité des personnes que je connais sont prêts d'avoir la vie de retourner à normal. It's been a long haul. As I can imagine that it must have been just over 100 years ago with the last pandemic. People are tired. People are doing what we asked them to do. I appreciate the sacrifices New Brunswickers are making. I appreciate the sacrifices that the citizens of Carleton are making. And I look forward to having more needles in arms. And I commend our Minister of Health and what we see in our budget to bring forth a strong New Brunswick to help us in our recovery, not only economically, but in terms of our health. My mother-in-law, Dorothy, she'll be 92 shortly. She got her vaccination last week. My mother, Noreen, she'll turn 82 this summer. She'll receive her vaccination on April the 1st. Hoot Smith in Hartland was the first person to receive the vaccination yesterday at a pharmacy in Hartland. It's nice to see. It's a relief for everybody. I can only imagine. I haven't received mine yet, but I will as soon as I can. And speaking of my mother, I often think of my father, God rest his soul. My father was a political cartoonist, and I often think, what would he be drawing with this legislative assembly? What cartoons would he be coming up with? I'm sure there would be a lot of giant needles. And I've thought of him quite often because I appreciated the work that he did, along with many other New Brunswickers. When he passed away, it made the front page. Quite a thing. And I'm proud of my father, my mother, and my mother-in-law. I would also like, unfortunately, my father-in-law also passed away, my father-in-law Rudy. I would love to have another conversation with him, especially now that I'm elected member to the Legislative Assembly of New Brunswick. I think he would get quite a charge out of that. Because we've returned to yellow, this has allowed the elected members of our legislature, you and I, to continue with governing New Brunswick. On March 16th, our finance minister delivered the budget speech outlining the New Brunswick government's next fiscal year. The budget comes at a time when the COVID vaccination program is getting underway. An examination of the budget with an eye to our communities will find resources being directed towards safer communities and reducing the illegal drug supply. Before I move on to that, when I spoke to our Shoppers Drug Mart Pharmacy in Woodstock, and I asked them if they were ready to deliver vaccinations, the owner of the pharmacy said, absolutely, we're ready. In fact, I hired another pharmacist to help. This is what's happening across our province. People are stepping up to help. This is what we need to celebrate. We need to come together across the aisle, all the parties, and celebrate New Brunswickers for what they're doing. Part of what we want to accomplish as a government, included in the budget, included in the mental health, is to tackle the illegal drug supply, to address people's mental health needs and addictions by expanding our mental health services. J'avais entendu beaucoup que c'est seulement 7 millions de dollars, mais en réalité, c'est un ajout de 7 millions de dollars de ce qu'on avait déjà. With this extra money, we will be able to have mobile mental health crisis units, because people need help. If they want help for their addictions, they need to have a place to go. The rising crisis in mental health that hasn't been helped by the pandemic, with the isolation of people from one another, with not being able to shake hands, not being able to hug one another, not being able to adequately celebrate somebody's end of life. These things have caused great pain and will require a great deal of time to heal. I've been concerned for a long time about the drug problem in this province. I've been concerned a long time about the damage that it's causing to our young people. As a high school principal, j'ai commencé d'enseigner en 1800, imagine ça, en 1985. At that time, the big thing was weed, maybe acid. And I was young enough, I could tell if I had a high school student that was high in my classroom. Today it's different. It's no longer marijuana. It's pills. It's meth. It's taking away a whole generation from our society. As a government, we plan to address this. We've already started. We're addressing it through enforcement, and we're going to, we address it through mental health. In my school, I had the integrated service delivery team. Some of the finest people that I've ever had the pleasure to work with. They supported my school, they supported my students, they met with them on a regular basis, they met with clients from outside of the school, and they helped people deal with their mental health issues and their drug problems. But a lot of people don't understand. And what bothered me a lot, and it still bothers me, the violence that comes along with the drug issue today. I would encounter a student in the hallway, and they would have lost 40 to 50 pounds. And maybe out of a little bit of jealousy, I'd say, "Holy, you're losing a lot of weight. What are you doing?" Of course, I knew it was meth. But I'd get answers, "Well, I stopped eating Kentucky Fried Chicken." "Well, I really like that, but maybe I should give that one a try." My vice principals and I met with a student one afternoon, and when we finished meeting with her, we thought, my goodness, she may not be alive to graduate. She was so deep into the drug world, hooked on meth, subject to the whims of the dealers. We didn't think she would live the next 3 months. It's a good news story. Her father stepped up, helped her out. When she graduated 3 months later, she looked like a completely different young lady. And she's continued on. But see, the drug dealers are clever. And with the phones we have today, social media, you can e-transfer money, you can buy a pill, buy some meth, have somebody tape it under the toilet seat in the bathroom, and go in and get it. Just imagine. It's bad enough what they make it with, but then where do they go get it? Under the toilet seat. It must be horrible to be hooked on drugs. And as a government, with our budget, we plan on working diligently to address this issue, not only with our youth, but with society at large. Because today's youth are the future. In 1985, I took a starter pistol from a student at school. He was shooting it off up by the gymnasium. And I said, "What's that?" "Starter pistol." So I took it. So you can get it at the end of the day, don't bring it back. Today, that would be a full-fledged lockdown. In my last few years as principal, I never really knew what was going to happen. I've seen a lot of stuff over 35 years in education that we didn't talk about in my Bachelor of Education program. You know, we talk about mental health. We talk about people that die by suicide. It's a horrible, horrible thing when somebody dies by suicide. What's even more deplorable to me is when we try to use that for political advantage. I've seen students that are cutters, that have had their arms from their wrists to their shoulders, their legs, almost not a spot that hasn't been cut. People that don't understand what that is think that they're sick. Certainly, they need some assistance. They have some issues going on. But they're cutting to escape from the other pain that they feel. Whether it be drug addiction, whether it be child abuse, whether it be nothing to eat, whatever it is, there's a reason. Death by suicide is extremely tragic. It's so sad that somebody thinks that this is the only option they have to solve the problem that they face. Because that's what death by suicide is. It's not an irrational thought process on the part of a person. It's a person who most likely has not gotten the help that they were crying out for along the way. Not all of them do, most of them do. And a lot of times it's only evident when you look back at the signs. Through our mobile mental health units, we hope to be able to address more of these issues. I can't tell you how many students, and I don't want you to think it's like the majority of them, but it's a fair number, it's scary, that we took to the hospital to see the psych nurse, that we waited until 7 o'clock for the mother to come and pick them up because they were suffering from suicidal etiology, that would go up to the hospital. Some would go in the morning, talk to the psychiatrist over teleconference, and back in the afternoon. One young student, we had several days, where we had to try and help the student stay on the line, choose to stay alive. Sometimes they would walk out the door, and we would call the local police to pick them up because we had run out of options. We have a budget with over $2.9 billion in health spending, and it's by far the largest line in the budget. And it's required to tackle these issues. Almost every person in here has probably been touched one way or another by death by suicide. Either somebody in their family, or somebody that they know, or in a family that they know. Their government's plan and the steps we're taking to tackle the mental health issues in the healthcare system, we hope that we can reduce that number. We hope that we can demonstrate that we, notre collectivité comme député, de chaque côté de cette chambre, care about others. We are working with people within the system, community leaders, and all levels of government throughout the province to build a safe and sustainable healthcare system that is responsive to the needs of patients and communities today into the future. My doctor's a little bit older than I am. He's a fantastic family physician.
What time do you have?
He's been recognized by the province for his wonderful work. So, as I look at my life and I say, well, there's a 99% chance that I've got less years ahead of me than I have behind me, I asked him one day, when are you planning on retiring? Because I like to plan ahead. I don't know anyone I would find that would know my health as well as he does, other than myself. And he gave me the answer that I was looking for. Never. Perfect. That's not the same for everybody. We need to develop a model of recruitment of doctors, of nurses, of healthcare professionals, paraprofessionals, and a model of retention that this budget gives us the money to do, so that New Brunswickers can have a family physician. Or with the new model of the young doctors, New Brunswickers can belong to a team of physicians where they know that they can go to see somebody when they're ill. I'm hopeful that we can get some walk-in clinics, not just for mental health, but for health care. You know, when you go to the ER because you have a sinus infection, you really are taking up time of somebody that has an emergency. And you can sit there for 5 or 6 hours to get a prescription. With the teleservice that started and really picked up through COVID, it's ideal. It's helped a lot of people, and hopefully that'll continue into the future. It's not the same as sitting down across from my doctor, but it's an avenue for many to get treated for minor ailments rather than clogging up our emergency rooms. And I'll tell you, I've had the occasion to code through an error in judgment, and boys, I got great service. I don't remember most of it, but it was fantastic service. Emergency rooms need to be there for emergencies. Our government is committed to keeping emergency rooms open. The Minister of Health is currently doing consultations. How can we make New Brunswick's healthcare system sustainable? For us, for our children and our grandchildren, and into the future.